as you know, navigating through all of these health orders in the last several months has been nothing short of a roller coaster for contractors. It can be a difficult moment, especially for LBEs. So we're here to help as best we can. It's new for everyone, so you know, in some respects, we're navigating just in the same way. You know, we're still trying to figure things out as we go along. With every set of health orders that come out, a lot of times those health orders change drastically from the health orders that were just issued days or weeks prior. So I'm going to get into a presentation here. And let me
hey, Tony, before you get too far, I just want to let everybody know that we're recording this presentation just for posterity and for also so we can post on websites in case folks weren't able to attend. So just an FYI to everybody that we are recording this presentation.
No problem. So let's get going here, folks. We got quite a bit of stuff to cover. I'm not going to get super in-depth into the fine details of the health orders. That would just be a rabbit hole that would eat up a lot of time. So as we move along here, you know, please direct all your questions towards Ben, and we'll try to handle them the best we can at the end. So when you're opening up your job site, I know that there's going to be some of you out there that are currently working. I know that there's going to be some of you out there that are trying to figure out how to start your job sites. You might be the controlling contractor, you might be a subcontractor. You know, the first things that you're going to have to think about is, you know, your site-specific safety plan, your health and safety addendum that has all of the COVID-19 protocols involved. The other thing that is really important in the new health order mandates is to assign a company COVID-19 safety compliance officer. And no matter if you're considered large construction or small construction, you have to have a safety compliance officer. We're going to touch base on that a little bit later. You know, training is very important on all this. You know, your signage that needs to be throughout your job site, you need to make sure that that is posted in all relevant languages, because you can run into some issues there, of course. You know, the entrance screening that should be done now comparatively to what a job site was like before is an extremely important aspect of opening a job site and taking precautions with COVID-19. And you know, there's going to be best practices. There's going to be moments that you're going to rise above what Cal OSHA wants and above what the city and county may want. But when you're talking about signage and postings, you're going to have an entrance. You're going to have a checkpoint at your job site, and you need to make sure that you have all the entrance and exits and bathrooms. Anywhere that someone is washing their hands, you have these COVID-19 protocols about social distancing, about sanitizing, about hand washing, and make sure you have that in relevant languages, of course. Now, here's a couple examples. This is on one of our job sites that we're a part of out at San Francisco International Airport. And the safety manager, Skanska, was very happy to share these. And I thought these were really good. Skanska made these up themselves. But as you can see, there is like a 4 basic question that is going to be at the entrances of these job sites. And it's the same throughout the industry. This is what contractors are focusing on, is if you have been diagnosed positive with COVID-19, if you had anyone in the household, you know, who had COVID-19, if anyone in your home currently is quarantined for COVID-19, have you or anyone in your household traveled internationally in the past 14 days, and are you exhibiting any type of symptoms? You know, and we'll get into the symptoms later. I'm sure you guys have been, you know, hit hard with all of the COVID-19 symptoms. So these 2 pictures are great because these are 2 different job sites, and they post these right at the entrance. You literally get at, this is both outside too, which, you know, there's indoor moments too, but outside, before you can even get towards the job site, before you can even get to the checkpoint station, they're posting signage and hand washing and hand sanitizing stations. Now, I know that Job sites can be tricky. Sometimes they're tiny. People are working on top of each other. They're indoors. Not always going to be an outdoor moment. But this is a really good example of when you walk up to a job site, what the worker would see and what he's directed to do. And then after this signage, you get into a social distancing line and you get into the checkpoint. And at the end of that checkpoint, excuse me, at the end of that checkpoint, you would see something like this. There's going to be a worker there. That might be the safety compliance officer, or it might just be someone who's assigned to be the person at the checkpoint. It can be a laborer, it can be anyone. But that person takes all of the relevant information for the log that you need to keep, and your safety compliance officer needs to keep to be able to track anyone on your job site in the event that you had a positive COVID-19 case. I mean, heaven forbid, but it has happened at our job sites, more than we like. And we've experienced, everything from, okay, let's track the last 14 days of this worker. Let's find out what crews he was on, the locations. All of this becomes extremely important now, when before it wasn't that big of a deal. So when we're talking about the job entrance screening, that picture is a really good example of one of our indoor jobs at San Francisco International Airport. And you walk up, there's a hand washing station right outside there and a hand sanitization station. And then when you walk up, there's a piece of erected plexiglass in between you and the person that is doing the entrance screening. And what this particular company does is they have these little colored stickers that they put on people's hard hats with the date on it. So you know the day of the week and the date. And so while you're on the job site, you can keep track of if you have a lot of workers. Some companies only have a few workers, only have a few employees. That's fine. But if you have a little more than you can keep track of, a hard hat sticker is a really great way to know that that person checked in safely into your job site. The daily logs that you're going to have to keep track of and that your safety compliance officer needs to keep track of and have on hand at any time is very important. And that's the worker's information, that's their address, their numbers, the time frames, where they're working on the job site. Obviously, social distancing is important. I was talking about the colored hard hat sticker for the identification. Some companies are doing a wristband as well with the information of that day, or a colored wristband. I'm not a huge fan of that because you end up having to touch. Then you're reaching out, and there's something that transfers there. It's a little bit easier to do a little small sticker and put it on your hard hat. It's a little bit less of a interaction there. And when I say hand washing and sanitization stations, if possible, it's not always going to be possible, which you need to make sure that you have it available for your workers. And that might be something where it's on their person. You might have individual workers have what they need to keep clean and keep sanitized during the day. Social distancing and hand washing sanitization signage, that also is, these are the biggest spots that all your signage needs to be. And if you're on a job site that has stair scaffolding or different types of entrances and exits, make sure that is posted, everywhere, because it's really important. So keeping workers and visitors safe on the job sites, training is always the number one thing. As employers and as the owner of these companies, it's your responsibility to make sure that your workers are trained, but also that you have any visitors or special inspectors. You may potentially have people on your job site during this COVID-19 pandemic that they're not employed by you. So that's where training comes in with your employees. That's where that job site entrance becomes extremely important. The 6-foot rule is a social distancing rule. You want to make sure that your workers are wearing face masks, that they're proper non-medical face coverings. You can get into a little bit of hot water if you have face masks that have the vents on them. And I'm talking about the ones that you buy, on any website, and they have like a couple of vents that aren't filtered. People are like, oh, I love these vents because I can breathe better. And, you know, sometimes they have filters inside those little vents and you can just take the filter out. And then it's just like not wearing a mask at all. So that is frowned upon in the city of San Francisco heavily. So just make sure that you've got a simple, simple fabric mask that is breathable, and make sure you supply that to your workers. Additional PPE, you know, if sometimes you find your workers, they're just in a position where they have to work fairly close to each other, and you're worried about that type of contact, you're worried about them being too close to each other and breathing that air. You know, a lot of solutions can be a larger plastic face shield while they have to do that work. If you want to go the route of respirators, your workers have to be trained with those respirators, and they also have to be fit tested. It can't just be like me with a big hairy beard and throw a respirator on and you're good to go and you send them out in the field. You know, you can get in trouble that way, and you can also be held liable. So with barriers, you know, as well, I've seen some really innovative best practices with barriers where I've seen electricians lined up and they all had to be, you know, stuck together in this small space. And, you know, a little wood barrier, a little plexiglass barrier was put up in between, and it really gave the workers some peace of mind. And of course, they were wearing all the other PPE, but these are all just some ideas. Now, most larger construction companies require 100% PPE all the time. And, you know, throughout the time that I've worked with LBE contractors, some LBE contractors, you know, they're like, hey, that's not required by OSHA. We don't have to have these guys wear this, that, and the other. I highly recommend making a gloves policy for your construction company and for you as a contractor, because if you can get these guys to wear gloves 100% of the time, it's just a built-in extra form of PPE that could help save lives in the end, and it could also help save their digits. Proper hygiene, you know, you can't replace hand washing. You just can't replace it. You can use hand sanitizer is an excellent additional moment, but training your workers to wash their hands frequently and making hand washing stations available to them is huge. And with this COVID-19, you know, pandemic, I've seen construction companies add as much as 3 or 4 hand stations around the job site where normally there was only 1 at the bathrooms. You know, they'd have 1 at the entrance, you know, 2 on either side of the job site, 1 near the bathrooms, and make sure there's, you know, 2 hand washing stations at the bathrooms instead of 1, and then to make sure that your workers, you know, have hand sanitizer. And if you're using hand sanitizer, please be very aware that it has to be at least 60% isopropyl alcohol to kill COVID-19. There are hand sanitizers that are out there that are for sale that are cheaper that don't have as much alcohol in them. What we do for our construction safety manager crews with Merriweather when we're out and about, we have hand sanitizer, and we also keep a small spray bottle of isopropyl alcohol to sanitize things quickly, whether it be your gloves, your hard hat, your boots, you know, before you get back into your truck and you go to another job site and potentially take something with you. A little quick spray bottle of you know, ammonia-based, alcohol-based, bleach-based. This all kills COVID-19, and it's just an added extra step that you can take. Workers' mental health is an extremely important moment during COVID-19. COVID-19 has put an added level of stress and anxiety on your workers, and because all construction here is you know, considered essential, you know, you're like, hey, let's get to work, fellas. And it's so important as a controlling contractor, as the owner of your company, to create that safe environment, because it's not just about the physical things, and it's not just about, you know, I have hand sanitizer, here you go get to work. You also want to make sure that your guys are in a good mental state and their morale is up, and they're not fearful at work, and that they're being honest with you if you're asking them questions about, hey, what could we do better? You know, do they have the right training? A lot of guys just want to work and they don't want to cause any problems, and you know, it's up to you to kind of navigate that a little bit. So COVID-19 cases and other incidents. Now, this is something that I just recently put in these slides, because what I am noticing and what my friends in this who are in safety are noticing and we've been talking about, and this is mainly in the last, like, I would say month for me personally, but we've noticed an uptick in other incidents on the job site during COVID-19, and it's not because workers are inherently just wanting to be unsafe. What we think it is that their mind is in another place, and there's a lot more stress and anxiety going on with the COVID-19 moment. So you're getting guys up there, and we just had a very terrible incident happen, not on any of our job sites. I just read this, but this was in Los Angeles, and there's a stadium being built, and a gentleman fell 110 feet to his death. Now this gentleman was wearing a harness, but he didn't clip off. So, you know, if he's up at that type of height and his mind is so distracted, you really want to think about that with your workers and make sure that you know, the eyes on the prize and that everybody is focused, and you're having really good meetings and daily briefings with them, and your orientation is covering these moments. So I wanted to make sure I brought that up because I think it's a very important thing to touch base on. Bathrooms and wash stations, of course, clean and well stocked. On average, we're seeing on job sites, the larger job sites, they're having crews clean those twice a day. You know, highly recommend bare minimum once a day, but if you could swing twice a day, I know people always don't always have the personnel for that, but shared tools and equipment. So this is another example of when that spray bottle of alcohol, that spray bottle of that bleach cleaner, I see them hanging on scissor lifts now. You know, just you walk up to the scissor lift, you grab the spray bottle, you hit the controls, anything that you're going to be touching, you feel a little bit better about getting in the scissor lift after the 6 guys that just used it for the last 4 hours got out of it. It's the same thing with shared tools. As much as you possibly can, try to avoid sharing tools, but if you have to share tools, make some type of sanitization available for your workers. And it can be very simple and very cheap. I mean, bleach and water at the right proportions kills COVID-19 on contact. So, you know, having that available on your job sites is really important. You know, break areas, used to be you could just have a little break area set aside with a tables and everyone could just crowd right into it. Now we're in a different boat. You need to make sure these guys are social distancing, and a lot of these guys are really great friends. They've been friends for years sometimes on your job sites. And workers want to hang out at lunch. They want to hang out and get closer, and hey, you know, you want to bite of my this or whatever. It's something that we've really had to crack down on at SFO is, you know, everyone's social distancing when working, and then you know, you guys are sitting on the end of the tailgate at you know, for lunch. So so make sure that there's no shared water dispensers. You don't have a microwave out there for everybody to use. You don't have one little table sitting there that you say that's your break area over there. But you know, if it's outside, inside, you need to provide that shade as well for these guys. And it has to be social distance at this point. So staggered work shifts is another way that you can, you know, eliminate a crowded job site. Have guys come in at different times, stagger your shifts, and I see a lot of companies moving towards this. And it's a more difficult moment, but you know, the alternative can be dire. Toolbox talks. Just remember that every morning you guys should be having daily briefings with, and COVID-19 needs to be included in these daily briefings, and that's, you know, that's mandated. So your toolbox talks aren't just about ladder safety or fall protection anymore. You know, it's really important that COVID-19 makes it into every aspect. So here's a couple of pictures of some guys, and you know, the guys on the ladder and in the lift. You know, excellent social distancing, excellent PPE, and believe it or not, in that area there was about 30 employees. And all of these guys were figuring out a way to be safe around each other. And then the guys on the stairwell, you know, purposefully both went to the stairwell at the same time. One of them took back a little bit, hung back. Those guys, excellent PPE, face shields, the whole thing, you know, and those guys are going up to work on something in fairly close proximity together. But while they're cruising up to that spot, you know, they're practicing excellent social distancing. So exposure, symptoms, and reporting. So as a contractor, you need to have a COVID-19 action plan. So if something comes up, if heaven forbid somebody gets diagnosed with positive COVID-19 on your job site, you need to make sure that you have an action plan that's outlined. We're talking about COVID-19 symptoms in a second here, but to be able to track your employees' job site movement for the last 14 days is very important. And that's, if you're first starting out in your job, it's difficult. But once the job gets rolling, if anything was to come up, that is when you go and hit up your safety compliance officer and say, hey, let's take a look at those logs from the entrance, job site tracking, and let's find out exactly where Tony has been this entire time, because, how many people did he potentially expose? Where was he working? What surfaces was he touching? And of course, if you have any other subcontractors and other employees on site, including the controlling contractor, whether that be a public entity or an actual construction company, they need to be notified immediately. So with Cal OSHA record keeping, for COVID-19 cases, if COVID-19 was contracted on your job, it is recordable. And it needs to be logged in your OSHA 300 log, just like you would if you had any other type of recordable. A little bit later, Ingrid is going to talk about workers' compensation with COVID-19. But if something does come up and you have a positive case or multiple positive cases at once, which is what we've seen a few times on our job sites, that job site has to be shut down immediately. And you have to either bring in a third-party cleaning crew, or you need to handle the cleaning. Now, the third-party cleaning crew is a preferred moment for a lot of contractors, because they're usually set up and ready to go and do it much quicker and better and faster. But that also is an extra added cost. So when you're disinfecting your job site, you need to pay close attention to hard surfaces. You need to know from your safety compliance officer and track where this crew has been, where each individual has been. And a lot of smaller job sites, they shut the whole job site down, disinfect the entire job site twice, and then you're ready to get back to work. But like at SFO, we have job sites that are massive, and you have hundreds and hundreds of workers. So a lot of times they will close the area of the job site, which will be maybe a quarter or a half of that job site will get closed, disinfected. And before your job site is reopening, you need to decide, how you're going to communicate with your workers that it's safe for them to come back. Also, that it's safe for them to come back and they have a negative test result, because you either need to supply that test for them, or in some cases, like in the city of San Francisco, if you live in San Francisco, you have free testing at our fingertips, which is great, but not all cities and counties do that. So most construction companies that we're dealing with, it's required that the worker comes back. If they want to come back to work and they have their negative test result, that's the key factor. So I know you guys have heard this 100 times, but the COVID-19 symptoms, they've changed a little bit over the months. There's some new strange ones that have popped up. But for the most part, this is what you see, and this is what you want to make sure that your guys are being honest about. Some guys, they come to the job sites, check in. They got 5 kids. They're dying to work. They've been sick for 2 days, and they're just answering a questionnaire. You want to make sure that the attendant at your job site check-in is really also watching, making sure that someone doesn't look sick, isn't sweating or coughing or has COVID-19 symptoms. Yes, it might be a cold, but if you have fever, chills, cough, shortness of breath, fatigue, muscle ache, headache, loss of taste or smell, I always thought that was a strange one, sore throat, congestion or runny nose, nausea, diarrhea, all of these can be an indicator. So we've had so many health orders. And I know you guys know it, and you've been reading them, and it's probably been a little bit tough to try to digest all of the health orders, let alone navigate the health orders. It would be a lot for us to just really run through the health orders. That's hours of running through stuff. So So I'm going to try to go over them briefly, but please, if you have any questions, you can also hit me up later via email. You can give questions to Ben. It's fine. We can get you taken care of. But navigating these new health orders is tough. We've had sets of them through March, April, and May, and at April 28th, I believe, that set of health orders, that is what designated small construction and large construction. So working for PUC or working for the city and county of San Francisco, this is all considered public works construction, so it's a little bit different. But they had very distinct differences between what was mandated between small and large construction. And like I said, you guys are most likely all public works construction, so you don't have to worry about some of that stuff. But let's take a look at the timeline here real quick. So you can see, even after this May 5th moment, there has been some more health orders issued, but they didn't really change the construction aspect of those health orders, only a little bit here or there, comparatively to, the May 5th was more of the mandated and the rundown about public works projects, which is most of, like, all the projects that we work on at San Francisco International Airport, they're all public work. And the big difference is that, instead of having the differentiation between the small construction, which is under 20,000 square feet, and the large construction over 20,000, and there's some other mandates in there between small and large. The difference is, the main difference for me, when I first read the health orders from April 29th, and I saw, that they were requiring this JSAS person, a third party inspector on job sites, it was a little bit like, oh boy, this is serious business. And a lot of construction companies push back on that because, they just couldn't do it. They couldn't afford to do it, or they didn't think it was very reasonable. So that did get a lot of pushback. But public works projects don't have that mandate. So health and safety plan compliance updates. Your health and safety plan addendum. It doesn't necessarily have to be your entire safety plan just gets thrown in the garbage and you have to redo everything with COVID-19 in every sentence. Really, it's just you can follow what they're asking in the health orders, and you can create a health and safety plan COVID-19 addendum that is included with your current health and safety plan, if you have a health and safety plan, which you should if you've done any construction work, period. And all of these COVID-19 protocols, they need to be implemented into your daily work life. Every single job hazard analysis that you come up with for every task that you're doing on your job sites, every pre-task plan that your guys are coming up with and that you're coming up with, this all now has to have COVID-19 protocols in those JHAs and in those PTPs. And if those terms are new to you, we need to talk. Please hit me up and we can get a clearer picture about when you do get on that job site, when you do need to you have these 5 tasks that you're doing and these crews are doing this different thing, and you're like, I'm not quite understanding the approach with the JHA. I'm happy to help you on that front. If you don't have a job site orientation for your workers, you should think about putting one together. We can help you with that too. If you're a very, very small company, it doesn't have to be anything super extravagant. You want it to be job site specific. You want it to cover basic health and safety for that specific job site. But now, of course, we have to throw in COVID-19. We have to have all of the new COVID-19 protocols that are required by your county and city inside that job site orientation. Larger construction companies, their job site orientations, they run an hour, hour and a half. You're sitting in a room, used to be sitting in a room with, a bunch of folks getting ready to go out on the job site. You'd have to get your job site orientation sticker. Well, a lot of times with smaller companies, you can do a scaled down version of that out in the field that is a verbal moment where you're including that in your daily check-in, you're including that in your it's all wrapped up with your toolbox talks, and you're getting ready to get out on the job site. You're reviewing and getting your guys to sign that pre-tax plan that you're working on that day, or getting your guys to look over that job hazard analysis and know what the dangers are. Well, now those dangers include COVID-19. So having an orientation is always a good thing when you start a new job site. Even if you're a subcontractor, you can have a small orientation. And a lot of larger contractors will make all their subcontractors go through that orientation, as I'm sure you guys know. And you know, making sure that your workers fully understand all these COVID-19 revisions and plans and protocols. It's such an important moment. So let's get back to the safety compliance officer. So regardless, whether you're small construction, whether you're large construction, you know, whether you're a public entity, no matter what, you have to have a safety compliance officer. And that is someone that you, as the owner of your construction company, of your contractor, whatever your company is in construction, it's up to you to designate that person. And the qualifications are pretty minimal. It's a 30-hour OSHA construction safety. They have to have done that within the last couple of years. And first aid certification. Now, the first aid certification, very simple. There's classes you can take online that are extremely inexpensive. I think that the last one I did was in person, and it cost me. This was before COVID-19. I think it was like $35 or $40 or something. But the role of your safety compliance officer is kind of what we've been hammering this whole time during this presentation. It's really someone who takes control of how well your company is complying with all the COVID-19 protocols and mandates by the city and the county. And that safety compliance officer has to keep all those records. Now, you're keeping those records for a lot of reasons. Obviously, the main reason is if you have a COVID-19 case or cases that pop up, you need to access your records and see exactly, you know, where those or that employee has been that entire time, you know, for the last 2 weeks if needed. The daily briefings that are outlined in the health orders is basically like a toolbox talk. It's the safety compliance officer just giving a rundown to the workers in the mornings about, you know, okay, these are the things we need to practice, guys. Make sure you're wearing your mask, make sure you're social distancing, make sure you're cleaning those shared tools, make sure you're washing your hands. You know, it's a lot of it you would think is just basic common sense, but it's a pretty long laundry list, you know. So hopefully you won't need a remediation plan, but say you're checking out your job site and for a week it's just a non-compliant. The safety compliance officer cannot get anybody to get back in line. That safety compliance officer can basically shut down the site and say, hey, look, I'm going to tell the controlling contractor or the city entity that we are working for that this job site is not compliant, the job site is shut down, and you need to have a remediation plan in place in case you need to deal with that. So you cannot open up unless all your ducks are in a row. You can't open back up. So they say you need to report this to your designated county official. Now there is a ton of gray area here with the designated county official. At SFO, at San Francisco International Airport, the designated county official is kind of the supervisor that is working for the airport in a certain department. So say someone is the head of design and construction at SFO International Airport, and when there's something happens on a construction site, if there's a COVID-19 case, it gets reported to them. They are actually considered that designated county official. There really isn't a designated county official that I've seen or heard of, and correct me if I'm wrong, that is coming out to job sites in San Francisco and seeing if people are dotting their I's and crossing their T's on COVID-19. So the designated county official, if you work for a city agency, can be the owner, the supervisor, the controlling contractor, or who they're hired by. But this information needs to be recorded and supplied to them if you have a COVID case. And that JSAS that I was talking about that really doesn't necessarily apply to you guys, it was the job site safety accountability supervisor. And the reason why I'm putting it in here at all is because, you know, I want to make sure that, you know, if you think you need the JSAS, let me know, and we can make sure that either that's not the case or that is the case, because that is a huge added extra moment to hire a third party job site safety accountability supervisor and have them jump through all these hoops like the health orders call for. So usually you won't have to worry about that because of the size of your company, but really because also you work for a public entity. So there's a safety compliance officer checklist that I found on a favorite website of mine, and it basically just runs down like, hey, you know, when you're going through your day as the safety compliance officer, whether that be you personally, you took on that role in your company, or you assign that to somebody else, whether that be, you know, it doesn't matter who that person is, as long as they have that OSHA 30 hour and as long as they have that first aid. So you want to make sure that people are washing their hands, entering and leaving the site. You want to make sure that they have the entrance screening buttoned up and all nice and, you know, and tight on that front, especially that job site entrance screening, because that's where all your record keeping will come from for all the workers that come onto the job, and visitors too. You know, you might have those third-party inspectors that need to come on and inspect your job site. They have to adhere to all of this stuff as well. They don't get to blaze by anything, you know, and we've seen people try to do that. COVID-19 exposure, you need to make sure that guys are aware of how that is possible and what to do if they get exposed. Symptoms, report to supervisor, the daily screening protocols that you're doing, those 4 questions that we talked about, the job site rules, and pre-job site travel restrictions. Now that's a big one, because one of the moments that we had at SFO at the airport was guys going against the travel restriction of carpooling, and they carpooled together, and guess what? The whole carload of them ended up with COVID-19. So that being said, you need to really stress to guys. I know a lot of guys, you know, aren't coming directly from the city, and if you have workers that are coming from far away and their buddy is on the way or he lives in the same city, you know, it's really not a good idea to let these guys sit in the same car together for hours and hours at a time when they're potentially exposing other workers. So carpooling is something that you really need to talk about. Sanitization and hygiene procedures, always. Worker feedback and safety and sanitation improvements. Now, I think that this is really important as well, because all of these protocols and implementations and safety plans and getting your safety compliance officer on board, that should not be done at a desk behind closed doors. That should also include the workers that are going to be exposed out there in the field. And it's important that those guys also have that two-way street. They also have that safe moment where they can go, hey, boss, this is not up to par, and I don't feel like that this is a safe moment for me. And it's, you know, it's not good for us out there, because we need a little help from you on this. Workers that are afraid to speak up in those moments, you know, sometimes they can end up to be the ones that get exposed too much or they get hurt, and we don't want that. So construction site, daily cleaning, sanitation, we kind of already talked about that. Most construction companies are doing that twice a day. They have either a 2-person crew or a 3-person crew, or even 1 person that's just, you just get to do this twice a day. And they go through and they take care of business. And you can also hire a third party to do that. They sweep around the Bay Area and go to different job sites and are doing nothing but cleaning. So we talked about the remediation plan, and if you would need the remediation plan or not. Hopefully you would, you know, make sure that you have everything in line to where your safety compliance officer doesn't ever have to come back to you and say, hey, you know, this site is just not up to par on COVID-19 protocols. But there won't be any, the city won't allow any construction activity if non-compliance happens on your job site. So you can also get in a lot of trouble if the records show that there was non-compliance by the safety officer, and you keep pushing and working, and then you have some COVID-19 cases, you can get in a lot of trouble and be liable in that position. Repeated non-compliant workers appropriated to job supervisors. Yeah, it's the same thing. Designated county officials, your supervisors that are involved there. These will be available to you guys. All of these resources. This entire presentation will be available to you. But I really love the United Contractors website. United Contractors, they not only have a media center that has different checklists and different templates, excuse me, They have all kinds of information, and it's usually California based. So I recommend checking that out. Of course, Cal OSHA, they have some good resources as well. There's some CDC guidance down there. I'm going to, at this point, turn this over to Miss Ingrid Merriweather. She is going to cover some COVID-19 workers' compensation moments here. And Ingrid, are you ready to rock?
I am. I'm ready. Can you all hear me?
Excellent.
Okay.
I can hear you great.
All right. Thanks, Tony. Well, it should be very evident to everyone that, the importance of implementing the COVID-19 safety protocols and requirements and, studying them, understanding them, and implementing them. And one of the reasons is that the way workers' compensation is going to apply has really been established by the governor through an executive order that was issued March 19th. It's currently stated through July 5th, but all indications are it's going to be extended. And essentially, it says that employees who contract COVID-19 while working at the direction of their employer from someplace other than home, so for all of you, that's pretty much the majority of your labor force because they're working at job sites. If they contract COVID-19, that will be considered that it'll be presumed they contracted it at the work site. So the burden of proof is actually on the employer to prove otherwise. So it's really a complete reversal of how workers' compensation normally works, where the employee has to prove that their injury or illness occurred at work. This is the reverse. It is presumed that the employee contracted COVID-19 at work, unless they were working from home, that's the exception. And that the burden of proof is on the employer to prove otherwise. And essentially, in our opinion, that's a really difficult thing to do. If you have an employee who is working outside the home, working at a designated worksite location, and they contract COVID, it's true. There's no assurance that they contracted at the work site. They could have contracted it when they went to the grocery store a week ago, or when they went around a loved one who ended up having it and was asymptomatic. But the state has decided that for the time being anyway, that they're going to presume an employee contracted it at the work site unless they were working from home, and the employer would have to prove otherwise. So if I were you, I would essentially assume I'm going to be deemed responsible under workers' compensation if my employee contracts COVID-19. Another change that was implemented with respects to workers' comp specific to COVID-19, it used to be that an employer had a 90-day period to basically investigate a workers' compensation claim where the employee could be sent to specific medical providers, where the workers' comp carrier can conduct an investigation prior to essentially accepting it as a workers' comp claim. That's not the case with COVID-19. That time frame for investigation has been reduced from 90 days to 30 days, and it has to be begun 15 days after notification. So you have 15 days when you've first been notified that a employee has contracted COVID, that a claim has to be filed for workers' compensation, and then there's 30 days to conduct the investigation. The other thing that they've made clear under workers' compensation is only going to cover standard workers' compensation benefits, not what you would call consequential additional expenses. So workers' comp always covers lost wages and medical care. That's it. Those two things are covered. So in a COVID case, you might have cost associated with protecting employees or how you have to remediate, as Tony talked about, after the fact. So costs you're going to incur for, PPE equipment, where maybe you are trying to provide some lodging for an infected person so that maybe they don't go home to their loved ones. Any additional expenses associated with dealing with the fact that you have a COVID case amongst one of your workers, that's not a cost that's reimbursable through workers' compensation. Okay, next slide. Thanks, Tony. So really this kind of comes full circle back to what Tony was presenting and the importance of you taking the guidelines very seriously and you implementing the protocols. So as Tony said, segregating workers, limiting the concentration of workers in any one location, staggering employee work hours, working in small teams if possible. Essentially, you want to, if possible, try to reduce the number of people working together. And if you're creating teams, don't intermix the teams, because you have to kind of think in reverse. When you're doing contract tracing, in the event you do have an infected worker, it's a lot easier to isolate who the worker has been exposed to or who's been exposed to the infected worker if you've been able to keep them in a small team where you knew, okay, they only worked with these other two people. I mean, all of this is not always practical to implement on your job site, but you should think along these lines and adapt them to maybe what you can do, understanding what the objective is. And then you absolutely need to document, communicate, and distribute safety protocol and requirements. And we took it one step further. When you establish your guidelines, your plan, your policy, whatever gets documented, I think it's a good idea to actually get your employees to sign it. So that way you avoid an employee claiming they were not aware of safety protocols or COVID-19 protocols. You actually have them sign off on a document indicating, yes, we're aware of the new safety protocols, we will honor them, and then put that maybe in a personnel file for future reference. Next slide, Tom. So if you have an employee who is COVID diagnosed, again, you want to report the claim to the workers' compensation carrier immediately. I wouldn't even play around with the 15-day window that you have. Because the other thing that will happen when you report a claim is it kind of gives you access to resources of your workers' compensation carrier. So they have a lot of knowledge and information and can help guide you through the process of what you need to be doing next. So the sooner you get in contact with them, the better, and the sooner you will access additional resources and expertise to help you. So for example, the next thing you have to do is you have to conduct an investigation and perform contact tracing. So as Tony was talking about those check-in points where people are essentially logging in for the day and indicating what area they're going to be working in, that is for the purposes of doing contact tracing in the event you end up with an infected employee. Now, when you get a claim, now the person who is doing the contract tracing should be the person who does your HR, your safety manager, if you have somebody just handles your workers' comp if you're small, but the person who usually deals with HR matters related to your employees, that should be the person who is designated with this responsibility. And then Tony, can you go to that, that template for me real quick? I'll show you what that looks like.
You know, I think that link is also on the last slide. It was on a couple of slides earlier.
Okay, but it's not on this one?
No.
Okay, then go back one slide and let me finish.
Let me just go back a couple of slides and find it.
Okay.
Hold on. There we go.
That's, nope, it's not there.
Yeah, hold on a sec.
Okay.
Should be trying to bring it up here. There we go. You got it?
Yep, I see it. Thank you. So
Yeah,
we
you're
just
welcome.
got this from one of our workers' comp carriers. Can you scroll down a little bit, Tony?
Yep.
So this is essentially you doing an investigation with the individual who has been diagnosed, one of your employees who's been diagnosed with COVID-19. This is the line of questioning that you're going to go through the process with them. So, you know, are you having symptoms? Which symptoms? Did you get tested? So really the basic information. Then you're asking them, well, has anyone in your household presented any of these symptoms? Have you been in close contact with anyone? Have you traveled out of the country in the past month? So essentially what you're trying to do is really try to discern if there's any possibility that this worker could have contracted the disease someplace other than the work site. Now, as you can see, this is really just taking their word for it. I mean, you ask someone if they've stayed in a hotel in the last month, you know, they may just say no, but the truth is, yes, they did. So you're really going on faith that your employees will answer this completely honestly. But according to the workers' comp carriers that we talked to, they said that they've found employees to be very honest about this because one of the things, you know, number one, they're scared, you know, to be diagnosed with this disease and the fear of them infecting their family or loved ones. So if you get this questioning done sooner, they're likely to have time to really process it. And what they're doing is kind of asking themselves these same questions because they want to know too, well, geez, who have I been around? Where might I have gotten it? Oh yeah, I did stay at a hotel last week when my family traveled to wherever. So it's good to do this early in the process before they're talking to anyone else and getting this information from them as best you can. Because if you feel that there is a chance that they contracted the disease someplace else, I mean, if they flat out tell you that, you know, their brother has it and he came over for a barbecue last week, well, now you have a potential way to defend this not being a workers' compensation claim. And that part of the process is handed over to the workers' comp carrier. So you would share this with the workers' comp carrier and they're gonna evaluate if there are any indications there that suggest the worker contracted it elsewhere, in which case it's not workers' comp, and it would just have to fall under their regular medical program. Thanks, Tony. You
Sure. Let me go through, get through a couple
yeah.
of these here. Sorry about that.
Here we go.
There we go.
Okay, so that's kind of the areas that have been addressed so far between the government, the governor's executive order, and how the workers' comp system has responded to it. Some things are still yet to be determined, and they're pretty important, pretty serious things. But, you know, it's just kind of a sign of the times that folks are trying to figure this out as we go. But one of those things that's yet to be determined is whether or not this is going to have an impact on your experience modification calculation and your rating. So what has occurred so far is the Rating Bureau, the WCIRB, that's the California Workers' Compensation Insurance Rating Bureau. They're the bureau that do all of the analysis of workers' compensation claims by employer to develop your XMOD, your experience modification rating, that really determines what range you're paying for workers' compensation coverage. So you know the higher your mod is, the more you're going to pay. So far, they have stepped forward and proposed to the state that COVID-19 claims be exempted from your experience modification, which I think is the right answer, that an employer should not be penalized by the calculation of adding COVID-19 claims to their XMOD. You know, one, it's not tied to necessarily any negligence of the employer. Two, it's this presumptive causation here, which, you know, there's not certainty that's where they contracted it. So why should you be penalized in your experience modification if you're having to accept it as a workers' comp case, when in reality they may have contracted it elsewhere? So that's a good reason for it not to be calculated. And we know that if a worker gets seriously ill by it, they can be in the hospital and be in ICU. And now we're talking about hundreds of thousands of dollars of medical expenses. And that would translate to an enormous impact on your experience modification if it were factored in. So this is what's been proposed, but it has not yet been determined if that's how it'll go. I feel reasonably confident that they'll be successful in this policy because this is the Rating Bureau itself proposing this. And I think they make a good case that this should not be so punitive to an employer, that it should be treated as an anomaly. Now, that being said, that's with respect to your experience mod. You still have a loss ratio on your workers' comp account. So all insurance carriers, including workers' compensation insurance carriers, are always doing a calculation of how much do you pay in workers' comp premium and how much are they paying out in claims and losses. So whenever you start getting upside down, when they're paying out more in providing, you know, medical and lost wages recovery for workers who are out on workers' comp, then what you're paying in premium, your account loss ratio gets upside down. And that can lead to substantially increased rates. It can lead to cancellation, making it hard for you to secure coverage elsewhere because that information is provided to other prospective workers' comp carrier in the form of your loss runs. But I sense that if the Rating Bureau is successful in having these COVID-19 excluded from your experience mod, that somehow the workers' compensation carriers will follow suit. That they too would somehow look to not calculate these in your loss ratio the same way as they did before. One caveat is they're still paying out the money. So there is still got to be some reckoning for workers' comp carriers who are now going to bear a pretty significant financial burden of covering workers who are infected with COVID and all their medical care and their lost wages. And that, in fact, has an implication for the workers' comp carrier themselves because they're highly regulated and they have to maintain a certain amount of reserves in relationship to their claims and losses. So what all of that is kind of starting to translate to is an overall increase in workers' compensation rates, because this is now starting to have a major impact on them that didn't exist before, and they're going to have to offset it in some way. So they kind of spread the impact by increasing everybody's workers' comp rates across the board. But, you know, that may not prove sufficient to the extent that they're going to be impacted. So that's why we're calling this yet to be determined. And then the last point here, again, this is pretty unique to this situation. Usually workers' comp claims are very straightforward. You can have a worker who's injured and you can have a family member bring a concurrent action because the family has been impacted by now that injured worker. So, you know, you have a loss to the family if the worker was, you know, one of the care providers or just being a spouse. There's actually specific claims related to that. You know, my husband can't do what my husband was used to be able to do. And so those would happen on occasion. But now we have the possibility, and there's already a claim now working its way through the system, where a family member, this is actually happening with Amazon, where a worker contracted COVID, it's deemed a workers' compensation claim because that's the presumption, and the employer couldn't prove otherwise, and they went home, and now their family member has it. So the family member is now trying to bring a lawsuit against Amazon, claiming because the worker was infected at work, brought the illness back home, now another family member is sick. So you can see how far this can spin out. This will probably take a while to work its way through the system, and whether or not an employer could be deemed liable for the infection of a contagious disease resulting from their employee who contracted it on the job, that could be enormous. And I'm very hopeful that they're going to find the right approach to this, because, you know, at some point, this could render business just completely dysfunctional. I mean, you couldn't operate your business if this runs rampant. If you're going to be held liable for someone's father getting sick because you had an employee who contracted it and went home and infected their father. So I'm really hopeful they're going to find the right paths of solution to this, but these are things kind of yet to be determined. And so all of this really helps to underscore all that Tony said. Avoid them getting sick in the first place. Do everything you possibly can in regards to your work site, because you don't want any of this happening to you. You don't want to have to worry, how is it going to affect my mod? Or what if they take it home and get their loved one sick, right? You don't want to find yourself in that situation if you can at all avoid it. So taking all the proper protocols and precautions and investing in what's necessary to make your work site safe will put you in the best position you can be, also with respects to workers' comp. So I think is that my last slide, Tony?
Just a couple of links here.
Okay, yeah, so like Tony, we provided a couple of links, the Governor Newsom's executive order that I referenced. There's some back to work resources that tell you about worksite safety, and then the OSHA COVID-19, some of the streamlined pages, the FAQ in particular was one that we collected from a couple of our workers' comp carriers. And that's it for me.
So, Ben, did you want to jump in here?
Yeah, thanks, Tony. So I know that we covered a lot of information very quickly, but just so you guys know, the slides from this presentation will be available on Meriwether and Williams' website, which is on this slide. It's imwis.com. And then there will be these slides, the recording from this meeting, and then there'll be some additional links and resources, forms, posters, you know, those types of things that people can use. Also on this slide, you see Tony's email address is anthony@imwis.com. And you are able to contact Tony if you have specific questions or need specific follow-up around health and safety issues and safety in the time of COVID-19. There was one question that came up during the presentation, which I will read quickly to you, Tony, then you can try and answer.
Sounds good.
We're currently coming to the end of a project at SFO, and I'm in the process of trying to figure out how to put together a HASP addendum together.
Okay.
We have 2 teams of 2 employees that have 1 or 2 days of work left to complete after I submit the plan. Would I use the same procedures on that HASP addendum for 1 or 2 employees and for several employees? So like, are the procedures the same regardless of the size of the team?
Yeah, the procedures are the same, and it's really like we were talking about, site specific. You know, you have 2 employees versus multiple employees. You need to cater it towards that, to cater it towards the specific hazards that are already a part of that particular job, and then implement the COVID-19 protocols from the health and safety orders. So it really doesn't matter. You can get into a different type of COVID-19 worry if you have massive amounts of employees, and the potential for congregation is there. You do have less of a risk to your employees when there's less of them, and it's a lot easier for them to work in social distance and be safe. But as far as the HASP addendum, you really want to jump through the same hoops on that. And I can help you with that if you want.
Okay, thank you, Tony. So we are actually, that was the only question that we got during the presentation. So if folks are interested and have questions now, there's a function in the chat that allows you to raise your hand, and then we can see it and we can unmute you and you can just ask your question live. So anybody that is interested in asking a question, if you don't mind going into to that function and raising, it's just called raising your hand, and we can see that and we'll unmute you. Otherwise, if there aren't any questions, what we'll do is, Sushil has put a couple of links into the chat function, and we would hope that everyone could click onto those. What they are is actually requesting you to subscribe to the email outreach list for the LB Co-op organizing group, which would allow you to, receive emails and invitations to the future webinars. So if you wouldn't mind signing up there for that, we'll be happy to reach out to you. As we mentioned, the presentation will be available on the Meriwether website at imwis.com.
And please reach out to my personal email there at the bottom of this slide. Even if I don't know the answer to the questions that you're asking, we can research that and we can get you an answer. Don't feel like you don't have a resource here, because we're very happy to help.
I'm not seeing any hands raised though, so I'm assuming that everybody is feeling either overwhelmed by the information that Tony and Ingrid presented, or so that they just are have very specific questions they will follow up with. So, okay, thank you guys very much. We really appreciate your time, and good luck with everything.
Thank you, Tony.
Thanks, Ben. Thanks, Ashil. Thank you, everybody. Stay safe.
Thanks, guys.
Bye.